Hello, everyone, and welcome to LLS COVID-19 Antibody Research Study, Your Questions Answered. My name is Elissa Baldwin with the Patient Education Team at the Leukemia and Lymphoma Society, and I will be your moderator today. We will have a brief question and answer session after the presentation where our guests will answer commonly asked questions about the LLS study. Special thanks to Dr. Larry Saltzman for sharing his time and expertise with us today. Before we begin, our Chief Medical Officer, Dr. Gwen Nichols, would like to welcome you to this important program.
Hello, I'm Dr. Gwen Nichols, the Chief Medical Officer of the Leukemia and Lymphoma Society. I'd like to welcome all the patients, caregivers, and healthcare professionals listening to this informative question and answer session. At LLS, we hear from blood cancer patients and caregivers each day about the profound effects the pandemic has had on their cancer care, on their daily lives, including questions about COVID-19 vaccination and how well the vaccines may work in people who have blood cancer. We understand that you're experiencing a lot of uncertainty about the impact of COVID-19 on your cancer care and may have many, many questions about when and if you should get vaccinated. In February 2021, LLS began to collect data on COVID-19 in our patient registry. We understood that COVID antibody research needed to be done. And so in February, this study began. And over the ensuing months, we have over 3,500 patients that have had blood drawing and taken part in this study. And our registry now is over 8,000 patients. We'll be sharing some of these results with you today. The study is ongoing and will be continuing not only to understand safety and efficacy of the vaccines, but soon some information about whether other parts of the immune system besides antibodies are important for your ability to respond to the vaccine. And this is especially important for patients who don't make normal amounts of antibody. Blood cancer patients, we know, are among those at increased risk of developing more severe illness and even of dying from COVID-19. So we encourage blood cancer patients to get vaccinated unless your healthcare provider says you have a medical contraindication to do so. Because the vaccines may not work fully in blood cancer patients, we also recommend continuing to follow all prevention measures as an extra layer of protection. Our motto is get vaccinated and act unvaccinated. By acting unvaccinated, we mean cancer patients and their caregivers who have been fully vaccinated against COVID-19 should continue to take preventative measures, wearing a mask, hand washing, avoiding crowded indoor spaces. You need to control your environment. If you are a blood cancer patient or a caregiver who is hesitant about the vaccines or are waiting for more vaccine data, we really want you to pay attention to this program to get many of your questions answered. Please also consult with your doctor about the vaccines. At LLS, our top priority is to keep blood cancer patients safe. Today, you'll have the opportunity to hear from our Executive Research Director, Dr. Larry Saltzman. He's the primary investigator of this COVID antibody research study. We look forward to sharing the results of our study and our ongoing research. Thank you for joining us today.
Thank you, Dr. Nichols, for your remarks to start off our program today. And thank you to our viewers for watching as you continue to face your or your loved one's blood cancer diagnosis during the pandemic and beyond. These past 18 months have been so difficult for the blood cancer community. As an acute myeloid leukemia survivor myself, I can understand the deep concerns and fears of patients and caregivers. Like many of you watching today, I signed up for the new LLS patient registry and then the COVID-19 vaccine study. Cancer patients generally weren't included in the clinical trials, which created real concern for the blood cancer community and how we would react to the vaccines. Would we have adverse reactions? Would they be effective for our immunocompromised community? Were we going to be protected against this highly transmissible disease? These questions needed to be answered, and LLS took on the challenge. Since we started the patient registry, over 8,000 patients have signed up, and many of them also participated in the vaccine study. Today, we are excited to have Dr. Saltzman with us to explain the results in more detail. I am now pleased to introduce Dr. Larry Saltzman. Dr. Saltzman is a chronic lymphocytic leukemia, or CLL, survivor, board-certified family physician, and now the executive research director for LLS. Diagnosed with an aggressive form of CLL in 2010, Dr. Saltzman went through multiple treatments, including CAR T-cell therapy. He retired from active clinical practice and was soon retained by LLS, utilizing his clinical and IT experience to help build the National Registry of Blood Cancer Patients, searching for patterns of care to produce better outcomes with less side effects. With Dr. Gwen Nichols, he leads the COVID-19 vaccine study and is excited to share the results with you today. Dr. Saltzman, I am now privileged to turn the program over to you.
Thank you, Alyssa and Dr. Nichols, for the introduction. The purpose of this webinar is to provide information regarding the progress of our LLS National Patient Registry. We will present findings from our initial publication. We will attempt to answer frequently asked questions and have this serve as a kickoff for regular webinar reports. I'm Dr. Larry Saltzman. As was mentioned, I'm a family physician. I founded a health IT company in big data. I am a chronic lymphocytic leukemia patient surviving since 2010, and I am the principal investigator for our LLS National Patient Registry. This is meaningful to me because through my treatments for CLL, I have been on almost every combination of therapy that one might be concerned with, including bendamustine and Rituxan, ibrutinib, venetoclax, surgery to remove my colon with regard to a lymphoma obstruction. In preparation for my CAR T therapy, I had 3 rounds of different chemotherapies, and currently I am taking IVIG on a monthly basis. The LLS National Patient Registry is a means to collect medical records to compare outcomes. It's a research study supported by an institutional review board consenting process. We are registered with clinicaltrials.gov, and it provides a unique opportunity for blood cancer patients to join LLS and increase our scientific knowledge about how COVID and COVID vaccines affect all of us. This is an observational study, which means it's not a means to evaluate new treatments or medications. It's observational. We are looking at booster questions to inform our constituents about that. It's important to point out that LLS is not a medical provider, and therefore we cannot give specific clinical or medical advice based on a particular question or person's problems. LLS can collect patient-reported outcomes, and we do that via surveys. And this is akin to what's called a Framingham cardiac study. And for those not familiar, the town of Framingham, Massachusetts was asked about 60 years ago to allow heart researchers to collect information about them, including their medical treatments and blood. And it was through that observational process that we now know that cardiac disease is worsened by smoking habits, by high cholesterol and high blood pressure. This was part of the study, and we are trying to do the same for blood cancer patients in an observational manner to look for outcomes that are positive based on treatments and making sure that side effects are lessened in our treatments. Now, the technology for this is run by a company called Citizen. And that's important because we get asked if this is a real company. It is not LLS, it's our technology partner. The medical record collection is HIPAA compliant. There is no work on the medical provider's part because we and Citizen request records, and you can be a part of this registry by only, I say only, being a blood cancer patient. It is not necessary for you to have had the vaccine or had COVID. We are primarily looking at and for blood cancer patients. Record requests for updated records are asked on a periodic basis. We do patient-reported outcomes via survey collection, so you may receive surveys from us. These invitations for ongoing research will be sent. Personal health information is stripped from all of your records, and LLS-approved researchers will study the records and the results. And if an outside party wants to review our research, you will be asked for consent to send your de-identified records to a third party. Now, for the basis of the study, blood cancer patients are among those who are at increased risk of developing a more severe illness from the virus that causes COVID-19. This includes a higher risk for severe infections and death, unfortunately. The initial COVID vaccine trials did not include blood cancer patients, leaving us without important information about how well COVID vaccines will work for us. The vaccines may provide less protection to people with some types of blood cancer, or various blood cancer treatments like chemotherapy can affect how the vaccines work. And I will go over the results of our first study in a few minutes. The registry itself was launched this year, 2021, on February 22nd. Given the COVID vaccine availability, we launched our COVID antibody response study on March 18th, just a few months ago. Since then, we've had over 8,000 patients register for our project, and over 3,500 patients have been to our lab partner, LabCorp, and submitted blood samples for SARS-CoV-2 antibodies. We have published a research paper this past July 2021 in a peer-reviewed journal called Cancer Cell, based on an analysis of 1,445 patients as of May 12th. And this is the largest COVID vaccine response cancer study in the United States. Surveys were collected from participants that formed the initial study interpretations. Medical records for specific treatments as related to COVID are going to be processed in the coming months. And therefore, this study was based on survey results and lab results. The lab tests we included were a Roche assay. This is worldwide best, most sensitive assay for COVID vaccines. We're asking and studying the nucleocapsid antibody response, which diagnoses a current or previous COVID infection. This is reported as either negative or positive. And then we're asking for a spike semi-quantitative antibody level, which measures the body's antibody response to a natural infection or the vaccine. And since we're studying the vaccine response, this is why we also ask for a nucleocapsid test to differentiate a response from an infection versus the vaccine. And this antibody spike semi-quantitative test is looking at a combination of immunoglobulins, including IgA, IgM, and IgG. The report is a numeric value, and that value is limited to the test sensitivity, as we'll go through again in a minute. We are looking for semi-quantitative spike antibodies, including the antibodies as mentioned, and simply stated, a semi-quantitative antibody result of less than 0.79 equates to no response. Most people will see these as a value of less than 0.40. A value of greater than 0.8 indicates a response. LabCorp has changed the results midstream in the month of May that now indicates a top positive response of greater than 2,500. Prior to May, it was greater than 250. Now, this is more sensitive in the upper range. Anybody who had a test before May and after May, if a result was reported that's between 0 and 250, those are comparable apples to apples, and those results remain the same. There are questions about how our results compare to normal healthy population. And there are no official reports of what is protective. This is an important question that we get asked, and it's something we cannot answer specifically. Having said that, two values pop out to us from the clinical trials for the vaccines. One is that a number value of 200 is the reported number that indicates a full response to the vaccine in healthy individuals. So when we're asked, is my number considered a healthy response? If the value is greater than 200, we would say yes. If the value is, let's say, 132, which is less than 200, we know that that's a value that the Red Cross blood banks use to decide if a plasma sample contains enough COVID-19 antibodies to be used for plasma treatments, which are now being given if somebody is diagnosed with COVID. So a result of greater than 200 does imply a full response to the vaccine. Whether your number is 200 or greater than 2,500, there is no data and there's no answer to which number is better. We just know that that's the vaccine response number. Now, the results presented will be generalized based on the types of blood cancers and treatments. This presentation cannot touch on any of your personal results. Your results should be shared with your provider because they know your case better than we do. And reported side effects from our participants, side effects to the vaccine, are no different than side effects of the vaccine trials. There were no greater side effects reported, and therefore we stick by our recommendation of get vaccinated, although we should all act unvaccinated, meaning wear a mask, especially in crowds or indoors, social distance, and hand washing, and any protection that you can give yourself would be best. Now, our results again were published in the Cancer Cell peer-reviewed journal based on data collected as of May 12th, 2021. And in reviewing continued analysis, because we're now into August, we find that the trends that we reported are not changing. So the big picture here is that we reviewed, again, a little over 1,400 results, and 75% of blood cancer patients have an adequate antibody response. That's important. And additional data, again, shows these trends are persisting. For the 25% of patients who are seronegative, these percentages vary by the type of blood cancer and or the type of treatment that has been received in the recent months or years. And I'll go through some of this. Our findings were statistically significant, meaning they were looked at by statisticians, and in general are in line with studies published in the UK and Israel, as well as smaller studies in the USA. The following results I'm going to show include all participants, whether they have been treated recently with blood cancer therapies or not. So here we go. I have showing these based on the type of categories of blood cancer. And as you look at these, the red color indicates there was a response. The gray color indicates the percentage of non-responders. So if a person has a diagnosis of smoldering myeloma and they receive the SARS-CoV-2 vaccine, any one of them, we're showing that those constituents have 100% response to the vaccine. And if you have multiple myeloma, we show that 95% of the people we've studied have a response to the vaccine. So these are very compelling numbers. These are the numbers for patients with myelodysplastic or myeloproliferative neoplasms. Again, 97% of MDS patients or patients who may have high platelet counts, 97% have a response to the vaccine. Okay, one more step. Now we're showing myeloid leukemias. These are CML or AML. Again, 97% of CML patients respond to the vaccine. 91% of AML patients respond to the vaccine. Again, the gray bar, if you do the subtraction, so 9% of AML patients do not respond, and that's probably related to recent treatments that they have been on. This is the bar graphs or the pie charts, if you will, for lymphoma patients. Again, going from, I guess most comforting to least comforting. Hodgkin's lymphoma patients, 98% responded to the vaccine. And as we go down the list, we see T-cell lymphomas at 85%, non-Hodgkin's lymphoma not specified at 79% response, marginal zone lymphoma, 62%, diffuse large B-cell lymphomas, 79% response, and mantle cell lymphomas at a 44% response. As far as the leukemias, especially B-cell leukemias, we find that, again, for ALL, 88% of patients respond. For follicular lymphoma, 78% of patients respond. Waldenstrom's is a 74% response rate. And CLL, my personal favorite, is a 64% response rate. Again, most of the non-responders have some relationship to the treatments they're on. And let me put up this list so you get an idea of what we're talking about. This is just CLL patients and their antibody response based on the treatments they're on. So these are treatments that people have noted for the last 2 years. Now, if you look at patients who are not on treatment at all within the last 2 years, 17% of those patients did not respond to the vaccine. And we feel that that may be related to the CLL itself and the fact that a CLL patient's B cells may not be as efficient as a normal healthy adult. Now, where this gets dicey, if you will, is if you look at the treatment type called obinutuzumab, which is an anti-B cell treatment. People on obinutuzumab, show that 90% of those patients did not have a response to the vaccine. This is a very powerful anti-B cell treatment, and it obviously affects our ability to respond to the vaccine, as does rituximab in all cases, whether combined with a acalabrutinib or ibrutinib. The seronegative numbers are high at 77 and 85%. And even rituximab on its own 63% of patients are non-responders, and the numbers go down from here. So again, this relates to other leukemias and lymphomas. As an example, if there was a follicular lymphoma patient who was on rituximab, then their numbers are going to relate to this table, meaning a majority of those people, if they've been on rituximab in the last 12 months, are more likely than not will not create antibodies. And so we need to all be careful. Okay, so I'm going to move on now to some additional studies, and then we'll get to our frequently asked questions. LLS is currently involved in studying T-cell responses to the vaccine, because we know that in our human body, there are three components of a response. One is a B cell response, which is an antibody response managed by B cells. The second is a T cell response, which is more of the killer response and very important in managing any infection. And then there is cellular immunity. There are commercial tests to check on the antibodies from B cells, which we've been discussing. There are no commercial tests to look at T cell responses. And so LLS is working with a research company, and we've invited 1,100 participants, 700 who are seronegative and 400 who did make antibodies to act as control groups to study T cells. Now, because these are research studies and they are not EUA approved by the FDA, we cannot provide individual results. We can only report by categories of types of blood cancers and or treatments to blood cancers. And these will take probably 3 months or so from now to compile these results. So we will stay tuned for that. We are also asking people who have had vaccines now 3 to 6 months ago to do follow-up serology to look at changes over time. We are looking specifically at CAR T patients. You're looking at one of them right now to see what's happened with CAR T treatments, and stay tuned for that. And we are in the process of observationally studying participants who report to us that they have had a booster, however they have been able to receive it. LLS itself is not offering boosters. You know, again, LLS is not a clinical trial entity. We are only observing. So those who ask us if we can get you a booster, the answer to that is no, we can't. With regard to boosters, again, you know, we're not a medical provider or an academic medical center. So we cannot really recommend or comment on your individual questions. We are encouraging studies on boosters to assure that there is vaccine safety in blood cancer patients. This is the first question that needs to be answered. We are actively funding a booster study that will launch in the next few weeks at the Montefiore Medical Center in New York City, and we are looking for more centers geographically around the country. We will closely follow the experience in foreign countries where boosters are being investigated or administered, and we will monitor antibody responses in participants who notify us that they have received a booster vaccine. Again, this is observational, not interventional. Okay, so FAQs. We have compiled many FAQs from you, and I'll try and answer them as best as I can. These are what I call step-by-step questions. How long does it take to receive your antibody lab results? And the question is the answer is 3 to 5 business days. What if I can't find my lab slip to get a blood test and you will need to take a blood slip to the lab? You can email us at pact@lls.org and we will send you your lab slip, customized for you. Must I print a lab slip? Yes. LabCorp will not accept a lab slip displayed on a mobile device. Unfortunately, our participants must bring in a piece of paper. What if LabCorp is not convenient? Can I go to another lab? The answer to there is no, because different labs run different assays and our study needs to compare apples and apples. We do suggest that if your clinic site or lab site has a relationship with LabCorp where they will come and pick up lab samples from that site, that is just fine. You need to bring the requisition slip, the lab slip, to your lab, ask them to draw the blood, put it in a little baggie with your lab slip, and have LabCorp pick it up. That will work for us. Where are my lab results? LabCorp has a portal, just like most providers, and if you have one set up, you can see your results there, or you can call the LabCorp toll-free number, 800-282-7300, to ask for your results. And in our Citizen Technology Partners accounts, we will notify you when the results have been loaded there. We get asked if we'll send your results to your doctor. The answer, unfortunately, there is no. We do not have a means to mail or fax results to your doctor. We ask that you print them and share them with your doctor in any way that you can. Okay, what do my results mean? Well, as I said, the nucleocapsid antibody denotes whether you have had or have a COVID natural infection. And I'll say that the half-life of this test is about 85 days. So if the test is positive, it doesn't mean you're necessarily infected right now. It may be as long as 3 months ago. We won't have the answer specifically to that. The spike semi-quantitative antibody test measures the antibody response. Okay. We get questions about what does 0.8 mean, because that's on the lab slip, and 0.8 again is the cutoff for no response if it's lower than 0.8 or a response if it's higher than 0.8. Why does my lab test have a greater than 250 and a more recent test may say greater than 24,500? And as I've said, the sensitivity of the test was changed. Having said that, any number below 250 is consistent from one test to another. The higher numbers are just a higher dilution, it's called, and a bit more sensitive. Am I protected from COVID, depending on my test results? Frankly and honestly, we can't answer that question. And as you all know, there is now a Delta variant, which seems to be more transmissible. And so it's impossible for us to know what the numbers are that will protect any of us from this virus. And are the tests ordered by my doctor the same as LLS? Frankly, if they're ordered at LabCorp with the same test ordering number, then they're the same. But if they're ordered at labs, as an example, Quest or a private lab or just in your doctor's office, the answer is probably not the same. What if I've been off treatment in a year? What do your study results say about my antibody response? As I pointed out with the CLL patients and their treatments, our study, as reported, is showing that the longer you're off treatment, the better regarding a response to the vaccine. Anti-CD20 therapies such as Rituxan or obinutuzumab appear very long-lasting, and we would not ever recommend that you stop your treatment for your cancer to wait to get a vaccine. We wouldn't recommend that at all. You need to take care of yourself and you need to take care of your blood cancer. What activities are safe for me if I did show some antibody response? Again, can't really answer the question. We recommend continue keeping your guard up with masking, social distancing, and hand washing. Now, as I said, I am a CLL patient. I was treated with CAR T therapy in December of 2019, which is now more than a year and a half ago. my antibody response to the vaccine was negative. I didn't make any antibodies. And again, I don't know what my T cell response is. I don't know what my cellular immunity response is. All I know is that based on the test, they didn't see any antibodies to their sensitivity level of detection. So what's my approach now? My approach is that I'm not hibernating, but I am not eating indoor at any restaurants. I'm not going indoor to any movie theaters. I'm not going to any bowling alleys. I'm not going to any outdoor concerts or parties where social distancing is a problem. I am visiting with friends and family outdoors, and if I'm very close to the friends or family, then we are visiting indoors, assuming we're all protecting of ourselves and we're close. I can't tell you exactly what to do, but I think it's best that we all keep our guard up. Now, do I need a booster shot as a blood cancer patient? Honestly, this is yet to be determined. There's a lot of chatter about it, but we do not have the answer. How can I get a booster shot? Frankly, there's no clear path to this. Most states keep track of who's had vaccines, and if one presents to a state-sponsored site and they enter your demographics, they're likely to know that you've had vaccines already, and they're not going to give you a booster. If and when the COVID-19 vaccines are officially approved, meaning they're not EUA emergency authorized, then it will be much easier for a doctor to prescribe another shot, a booster, if you will, for any of their patients. And I believe that that's probably coming in the next weeks or very few months from now. How can I enroll in a clinical trial for boosters? Well, again, LLS is not managing a clinical booster trial. We are funding one, and we're looking for others. When information on trials become available, the LLS Informational Resource Center and our clinical trials team will have that information. So again, stay tuned. Now, what about if you're hesitant to get the vaccine? Are there side effects from the vaccine worse in blood cancer patients? The answer is no, especially by our study. Does the vaccine lead to relapses of blood cancers? Honestly, there are some people who think coincidentally that they relapsed after they had their vaccine, but this has not been verified or reported in any studies. So we suggest everyone receive a vaccine. Is the speed of the vaccine development, does that mean that steps were missed? And the answer is no. These vaccines were developed over years, if not decades. The reason they came into approval so rapidly was that COVID was so rampant when they started administering the vaccines that the numbers of COVID patients in the vaccine trial who received the vaccine versus the numbers of people who were getting placebo, who then came down with COVID, happened very rapidly. And the numbers in tens of thousands of patients were statistically significant to approve the vaccine. When will the FDA fully approve the vaccines? Again, a lot of chatter. It's unknown. We anticipate in the coming weeks or months that one or all the vaccines will be finally formally approved. Based on treatments that a patient is receiving, should the vaccine be postponed? The general answer is no. And the only answer that I can say where this may need to be postponed are for blood cancer patients who are actively and currently having a bone marrow transplant. In that case, the vaccine should be delayed, probably for at least 3 months. That may be the only case where we suggest a time between treatment and vaccine. Bottom line again, get vaccinated and please act unvaccinated. Now, for additional questions, we have an email address that is very responsive. at pact@lls.org. We have a toll-free number that is a voicemail line. So if you call 844-696-7228, you will leave a voicemail and we will return your call as soon as we can. Again, the best place to get a response from us regarding our study is at the email address pact@lls.org. You may also visit LLS.org for COVID information. I mean, here's a web link. You can search on this on the LLS.org site. We appreciate your time in listening to this and watching this, and please stay tuned for other updates in the future. We thank you all for your participation. And Alyssa, do you have any additional questions for me? Thank you.
Thank you, Dr. Saltzman, for your very informative presentation. It is time for the question and answer portion of our program. Since the start of the COVID-19 vaccine study, many questions have come into our information specialists and LLS community. We hope Dr. Saltzman answered many of them today, but we have just a few more that we would like to ask. We will start with our first commonly asked question. If my spike antibody test results show less than 0.4, does that mean I'm basically not vaccinated?
Thank you, Alyssa, for that question. And the answer to that is no, you are vaccinated. If a test result comes in at less than 0.4, what it means is that given the sensitivity of the test, they could not measure any antibodies under that number, but there may be antibodies present. So you wouldn't think that you're totally at zero. You're just a little less than the sensitivity that's being measured. And having said that, as I commented on, with the vaccine, you may have a T cell response, which is protective, and you may have a cellular immunity response. Now, what I mean by cellular immunity is, let's give an example. When I had my second Moderna vaccine, I had a sore arm and I had a fever in response to that immunization. And in my mind and in my understanding of how our bodies work, that means my body recognized that vaccine from the first vaccine that I received, meaning I had a cellular response. And should I be exposed to COVID in the future, I would imagine that that cellular response will be activated again. Now, it doesn't mean that we should take our masks off and go, party like it was, a decades past or even currently. It just means that we should all get vaccinated and most likely have some kind of protection, although we don't know exactly what that is.
Thank you so much for that. For our next question, now you kind of briefly went over this, but should I stop my treatment to obtain a vaccine? So for patients that are currently on some kind of treatment right now.
It's a very good question. And honestly, this is something that you really need to ask your clinician or provider about, because as I said, we at LLS are not clinicians, even though I'm an MD, and we cannot answer these personal questions. Having said that, my view and our view is that unless your doctor says you should stop treatment, we would want you treated for your blood cancer in any and all cases. In my case, which I know is personal, and I mentioned already before that I've been on CAR T therapy. At the moment, I seem to be in remission from my blood cancer, even though I don't seem to have a B cell antibody response from my vaccines. And, speaking publicly, I would personally much rather be cancer-free and be very careful about my exposure to COVID than be in relapse. And therefore, our answer to this question is, Unless your physician advises treatment should be stopped for any number of reasons, we would not recommend that.
And now for our final question of the program. What, if anything, would stop me from getting vaccinated?
Again, another very good question. And our general perspective on this is that there's virtually no reason to stop a blood cancer patient from being vaccinated. I guess the question would be, what's the right time to do that? And as I mentioned, there is one special case with regard to bone marrow transplants where there is a period of time where vaccines of any kind are not recommended. And again, you need to talk to your provider. Having said that, no matter what treatment you're on or you've been on in the recent past, or maybe years or decades past, from our perspective, everyone should receive a vaccine.
Thank you so much, Dr. Saltzman, for sharing these exciting results with us and providing more information on where the registry and vaccine study will go from here. Since the initial recording of this webinar, a third dose of the COVID vaccine was approved for certain immunocompromised individuals. Dr. Saltzman is back to give information about the new FDA authorization and what this means for blood cancer patients.
The purpose of this webinar chapter is to provide you information regarding the recent approval of additional doses of COVID-19 vaccine for immunocompromised patients. Now, to recap and to make sure we're all on the same page, LLS is not a medical provider or an academic medical center. LLS cannot recommend or comment on an individual's booster questions. LLS is encouraging studies on these boosters to assure vaccine safety in blood cancer patients. LLS is funding a booster study currently at the Montefiore Medical Center in New York City, and we are looking for more of these centers. LLS will follow closely the experience in foreign countries where boosters are being investigated, such as the United Kingdom, or administered in Israel and France, as well as others. LLS will monitor antibody responses in participants who notify us of their receiving such a vaccine. Please note these are observational studies and not interventional studies. So here are some of the most frequently asked questions regarding this topic. Do I need a booster shot as a blood cancer patient? The CDC has given guidance that immunocompromised people may receive a third mRNA vaccine dose, essentially becoming a series of 3. These are now approved for Pfizer vaccine ages 12 and older, and Moderna vaccine ages 16 and older. The CDC has classified these immunocompromised people as the following: people in active treatment for hematologic malignancies, those who have been in receipt of CAR T cell or hematopoietic stem cell transplant within 2 years, or taking immunosuppression therapy, active treatment with high-dose corticosteroids, in other words, prednisone in a dose of greater than 20 milligrams or the equivalent each day, those on what are called alkylating agents, antimetabolites, and transplant-related immunosuppressive drugs, and cancer chemotherapeutic agents classified as severely immunosuppressive, TNF blockers, which stands for tumor necrosis blockers, and other biologic agents that are immunosuppressive or immunomodulatory. When should I receive a third booster? This dose can be given anytime after the normal series recommendation. That means 3 weeks for Pfizer and 4 weeks for Moderna. How can I get a booster shot? Given the FDA CDC approval A person may self-attest to a vaccine distribution center and therefore will receive a vaccine. This means a self-approval that you have a blood cancer or immunosuppressive diagnosis. The recommendations are to receive the same type of mRNA as the initial doses. However, if the same vaccine is not available, you may obtain the other mRNA vaccine. Now that the Pfizer vaccine received full approval by the FDA, and this just occurred yesterday, the 23rd of August, any doctor may write a prescription for the third dose to be given anywhere that has available vaccine. Now, is the LLS National Patient Registry providing follow-up antibody testing? The answer here is yes. For those with previous testing and a seronegative result, meaning no antibodies seen, we suggest testing 3 to 5 weeks after the third dose booster. For those with previous testing and a response showing antibodies to the spike antigen, in the best case, we would prefer a test prior to the booster and then a test 3 to 5 weeks after. Now, having said that, we understand that there's been a stampede to the vaccines, and we will try to work as best as we can with all who contact us. We will accept lab tests from your doctor for blood testing that may have been done in the interim if they have not been done at the LLS LabCorp service centers. Here are some specific questions. What if I'm wait and watch? What if I'm taking Rituxan? What if I'm taking BTK inhibitors? And can a booster make my lymphoma worse? For all the above questions, we suggest you consult with your physician, as you are an individual with nuances that we cannot comment in generalities. Having said that, we have seen that Rituxan is a very long-lasting drug, and the same for any CD20 inhibitors. These have long-lasting effects, and we believe their effects may last as long as 6 to 12 months. So again, please talk to your physician. If you're on a BTK inhibitor, these are oral drugs that are given on a daily basis to suppress blood cancers. Again, talk to your physician, and our view is that we shouldn't have you stop your cancer treatments just to take a vaccine. So again, talk to your physician. Now, how can I enroll in a clinical trial for boosters? Again, the only center that we know of, and LLS is funding, is the Montefiore Medical Center in the Bronx in New York. Their phone number is 718-405-8404. LLS will accept current registry participants for follow-up testing. If you are new to our National Patient Registry, we will ask you to supply any antibody lab tests you may have previously received. And the LLS Clinical Trial Support Center and its Informational Resource Center will monitor available trials. This question comes up frequently: should a caregiver of a close family member living in the same household receive a third vaccine dose? Again, this is an individual decision that you all should consult with your physicians as to their recommendations based on your personal situation. The anticipated recommendation will be that a normal, healthy adult should receive a third vaccine at an 8 months time frame after the primary COVID-19 vaccine series was completed. So you would need to check your calendar for dates. You should talk to your physicians. And again, based on the type of vaccine you're looking for, it should become available in September, or your provider can now write a prescription for you to get a Pfizer vaccine, if that is the one in your series. Now, for additional registry questions, please contact us at pact@lls.org. We do have a voicemail box, 844-696-7228, where you can leave a message. It is not answered automatically. You can visit LLS.org for COVID information. You can search the main website for the term COVID and things will pop up. Please stay tuned for future updates. And I thank you so much for your participation and your attention.
If we were not able to answer your question during this program, as Dr. Saltzman mentioned, you can contact the Leukemia and Lymphoma Society at 1-844-696-7228 or reach us by email at pact@lls.org. You can also still join the antibody study and patient registry by going to lls.org/registry. We also encourage you to please complete the program evaluation, which can be found at lls.org/vaccine-eval or by scanning the QR code on your screen with your smartphone. Completing the evaluation will help us to continue to provide the engaging and informative programming that would benefit you the most. Dr. Saltzman, thank you again for taking the time to speak with us today. And on behalf of the Leukemia and Lymphoma Society, thank you all for watching this program. Take good care.